Okay.
Hi everybody, this is Dr. Kramer here at Kramer Chiropractor, Livonia, Spine and Injury. Today's top tip is how to help someone with chronic whiplash. So we've talked about in the past, we're going to review real briefly. First thing you got to do when you're whiplash, make sure that you get a checkup to make sure you don't have a brain bleed or a broken neck. That's typically done in the emergency room. Next thing is you need to have a motion x-ray to determine the location and severity of ligament damage. And then the third thing is once you have found out the areas that aren't working right, you found out the areas where the vertebrae are stuck or moving too much. If you have a reversal in the curve in your neck, then we need to do some rehabilitation to get that curve back. You need a curve in your neck because people that do not have a curve have more headaches, more neck pain, more weakness, more disability, and they're more at risk for future degenerative joint disease. So I've showed you a couple of tricks, things that you could do at home with exercise. I've showed you some home traction. Now we're going to show you a different type of home traction. The first type of home traction that you can do is if you're in more of the acute stage. You've already been cleared by your doctor. You've already made sure you don't have a broken neck. You already made sure you don't have a brain bleed. Go ahead and hold this. The first thing we're going to do is just kind of pull gently up. Actually, we'll hold up for a second. So what this is, go ahead and put this over your head. Oh, nope, the other way. And pull it tight. Good. You good with that?
Mm-hmm. Lopsided, but
okay. This should feel good to you. It's distracting the joint. We're going up and back. If this was not comfortable, we would distract directly straight up. So if someone is in a lot of pain and they cannot bring their head back, we might start off like this. It should be pain-free. If they have any upper back, shoulder, or arm pain, this should actually relieve that pain. It should feel like it's literally sucking in the pain in your arms. It should feel like that pain in your arms is going away. If this makes pain in your arms worse or makes you blurry vision or dizziness, you should not do it. Now, as you progress with care, as you get better movement, as the inflammation calms down, as you get better alignment, now we want to try to do some curve correction or spinal molding. So we will gently bring her head back like this. Now this is done over weeks. Okay, for some people they can do this at 2 weeks, some people 4 weeks, some people 8 weeks. Everybody's different. These are things we do in the office to rehabilitate a whiplash, because good movement and good alignment is the best way for you to heal with your neck strong, with your neck with good range of motion and the least amount of pain. Okay. Now, once we can tolerate this, then we start going into something called two-way traction. So if your neck curve is reversed, then we're going to start to add another pull. Good. You good there?
mm-hmm.
All right, so now we're two-way. We are bringing the neck up and back. We're pulling forward. Now, what angle we pull depends on your measurement. We look at you like an engineer. For some people, we pull straight ahead. For some people, we pull up. So these are the progressive things that we do to help someone rehabilitate from a whiplash, whether it's the acute stage, when they're in a lot of pain, or we start going into the chronic stage where we're trying to reshape the spine. Again, the best outcome is we want to get you out of pain as fast as we can. We want your spine to heal strong. We want you to have good mobility. But if you heal with an improper curve, the outcomes are not very good. These outcomes have been demonstrated across the board in a variety of professions: chiropractic, osteopathic, medicine, surgeons. Everybody knows when you have good curves from the side, when you have good motions, good things happen. So again, if this information makes sense to you, and you know someone that's suffering from a chronic whiplash, do me a favor, just like it and share it. If you have questions, please just write them down on the Facebook page, and I will get back with you. If you're watching this on YouTube, you know what to do. Just click the subscribe. I'm constantly updating my channel with information to help you live stronger longer. So again, I'm Dr. Gregory Kramer, Livonia Chiropractor, Livonia Spine and Injury. Everything we do in this office to help you live stronger longer. I'll see you next week. Have a fantastic week. Drive safe.